or ingredients sa formulation, at ito po ay may proseso na kailangan pagdaanan para po manatiling safe ang bakuna. Maari pong pagkatapos nito, ang bagong formulation ay maari nang ma-store po sa milder temperature. Next slide. Kailangan ang mga nagawang bakuna, next slide please. Hindi po yan yung next slide ko. Yan. Kailangan ang mga nagawang bakuna ay maipadala sa mga pagamutan at health facilities sa iba't ibang parte po ng mundo na viable hanggang ito ay handa na pong gamitin. This is a very complex process that requires a very efficient system. Vaccines sent by manufacturers po to destination countries, they send it in special dry ice coolers. The destination countries can store in a national storage facility. Then the vaccine is distributed. In the unopened dry ice packs, the vaccine has 10 days to reach the vaccination center. Once delivered, the vaccines can be stored for up to 5 to 30 days in a refrigerator between 2 and 8 degrees centigrade. So nag-iiba-iba po yan, depende po sa bakuna. Now, next slide po shows the different vaccines developed na po for COVID-19 which have different temperature requirements. Makikita natin sa kaliwa. Ang Pfizer, -70, ang Moderna, -20, ang AstraZeneca po, Gamaleya, Sinovac, at Novavax, mga between 2 and 8 degrees po ang kanilang temperature requirements. To determine vaccine temperature requirements, manufacturers do extensive, time-consuming thermostability studies. Next slide. Let me focus po on two, which are both RNA COVID vaccines, but have different temperature requirements. Makikita po natin dito ang Moderna and Pfizer. Yung Moderna, shipped at -20, stored at -20 up to 6 months. Once thawed po, they can be kept in refrigerator at 2 to 8 degrees, good up to 30 days. Sorry po, nakalimutan ko yung minus dyan po sa tabi ng 20. But the Pfizer is shipped at -70, stored at -70 degrees po up to 6 months. Once thawed, it has to be put in the refrigerator 2 to 8 degrees, but it must already be administered within 5 days po. So nakikita po natin dyan yung pagkakaiba, no? Next slide. Clearly, we recognize that temperature requirements call for different distribution plans, and temperature integrity is really vital in the vaccine cold chain. Next slide. A vaccine cold chain is a global network of cold rooms, freezers, refrigerators, cold boxes, and carriers that keep vaccines at just the right temperature during each link on the long journey from the manufacturing line to the syringe. So the goal is, according to the WHO, is to ensure the uninterrupted availability of quality vaccines from manufacturer to service the delivery levels. Ito po ay hindi bagong konsepto sa ating bansa sapagkat matagal na ang Department of Health ay nagpapatupad po ng National Immunization Program at kaakibat po nito ang vaccine cold chain kaakibat ng programang ito ang vaccine cold chain. Next slide. Ang mga cold chains po, vaccines katulad ng mga matatagal na nating ginagamit na bakuna katulad ng MMR and flu po, yan ay pwedeng i-store sa temperature na between +2 and +8 degrees Celsius. A common refrigerator temperature lang po yan. Yun nilalagyan po natin ng tubig para palamigin. Yun po ang common refrigerator. Yung iba pong bakuna, kailangan ng -20 na temperature tulad ng varicella or chickenpox vaccine. Yan pong -20, yan po naman yung freezer kung saan natin nilalagay ang ating mga karne. Kanina nakita natin na meron din mga bakuna laban sa COVID, kailangan po na frozen sila sa -20 degrees centigrade. At meron pong mga bakuna na kailangan na ultra cold chain katulad ng Ebola vaccine na dinevelop po a few years back. Meron din pong COVID-19 vaccine na nangangailangan ng consistent storage at about -70 degrees Celsius. Next slide. Marami pong challenges o hamon ng vaccine cold chain katulad ng, next slide please. Next slide. Maari po ba? Ayan. Okay. Marami pong challenges katulad po na nasabi ko o hamon ang vaccine cold chain katulad ng electricity. Marami pong power ang kailangan ng refrigerator, lalo na po ang freezers at lalong-lalo na po ang ultra-cold freezers. Bukod doon, pwedeng may mga lugar na may unstable ang electric supply, kaya po kailangan natin ang mga UPS or uninterrupted power supply. Ang storage space ay kasama din po sa mga challenges dahil yung ibang mga COVID vaccines kailangan multiple doses, kailangan may storage space for subsequent doses at hindi dapat nito ma-displace ang storage space ng mga bakuna na kasama sa ating National Immunization Program kasi priority rin po naman natin yon. Pangatlo po, ang isa pong malaking challenge for vaccines that need ultra-cold freezers, hindi po ganong kadami ang mga lugar na meron nito. Malaking hamon din po ang time with vaccine distribution kasi po the journey from the factory to the point of care takes months, specifically an average po of 4 to 6 months. And once it reaches the country of destination, they can only be stored for a certain period of time. Once thawed, they can be stored for a longer period of, for a period of time until the time of administration po. Next slide. Next slide. Walang ulirang antas ng collaboration na kinakailangan upang maipatupad ang vaccine cold chain. Ang mga materyales na may refrigerator, freezer, coolers, carriers ay maaring nariyan. Ngunit kung walang mga taong gagalaw, naroon, tumutulong sa bawat hakbang, ay mahirap itong gawin. Meron pong mga manufacturer's responsibility tulad nung pang-una dito, yung vaccine manufacturing and even the distribution. Susunod po, may responsibilidad po ang mga distributor tulad po nung nakikita natin dito for the vaccine distribution. At meron din po ang provider's responsibility, yung arrival at the provider facility, storage and handling, and of course, yun pong importanteng administration of the vaccine. Hindi po pwedeng maputol ang tanikala, mahigpit ang pagkakapit-bisig. The vaccine cold chain needs timely, reliable, and efficient collaboration. And during this pandemic, everyone needs the vaccine and everyone has to have access to it, and ensuring a reliable vaccine cold chain is a strategic way to achieve this. So ang mga key messages ko po sa susunod na slide. Ang mga mensahe ko po, first, vaccine cold chain keeps vaccines at the right temperature during each link on the long journey from the manufacturing to the syringe that will be administered to the people. Pangalawa, different temperature requirements of vaccines call for different distribution plans. Pangatlo po, challenges in vaccine cold chain include electric supply, storage space, the availability of ultra-cold freezers, at panghuli po, the vaccine cold chain needs timely, reliable, and efficient collaboration of many players. Yung lang po at maraming salamat po sa inyong pakikinig.
Maraming salamat po, Dr. Eva. We'll now be moving on to the presentation of Dr. Wilda. Dr. Wilda, you have the floor. Dr. Wilda, if you're ready po. Thank you.
Thank you, Denise. Can I have the next slide, please? As everybody knows, we have this threat of measles outbreak here in the Philippines. This started as early as 2019 when we did a lot of supplemental immunization and outbreak response, and we were able to curb down the number of measles cases in 2020. But still, because of the COVID-19 pandemic, where we saw disruption in the provision of routine immunization services, not just for measles, but also for other antigens, we are still under this imminent measles outbreak. And everybody knows that as of now, we haven't controlled the polio outbreak here in the Philippines, and we are still doing some of the supplemental immunization as well as outbreak response immunization for polio as well. Next. This is the 2018 to 2019 measles cases by region. Some of you have seen this slide, and in 2020, you can see here that some of the regions are in light pink color, not the very red ones we saw in 2019. Some of the regions are doing their outbreak response immunization, while others are strengthening their routine immunization and catch-up immunization, leading to the lesser number of measles cases in some of these areas. However, in 2020, we saw some areas have clustering of measles cases for which we did the supplemental immunization as well as outbreak response immunization in selected areas. Next slide. So for the 2020 measles cases and vaccination status, still the most high risk are the under 5. One more click, please. Okay, most of the cases are under 5 years old. So in this slide, you can see that 54.7% of the measles cases reported in 2020 belong to the under 5. The light pink or peach color here is the measles cases recorded for 0 to 8 months. You know very well that we do not vaccinate children against measles if they have not reached the 9 years old. In special circumstances, we vaccinate 6 months old, but this has to be repeated or considered as dose 0 because the immunity or the development of an immune response when the child is very young is not optimum. So the reason why we are vaccinating under 5 for this Mropv campaign is because we want to build a good community immunity. And in the next steps of DOH, you know the school-based immunization program, which gives booster doses for measles, rubella, and tetanus diphtheria. Since there are no face-to-face interaction in school as of yet, we will come up with our strategy to provide this booster doses to address these measles cases among the older children here, among children older than 5 years old. Next. So coverage 2016 to 2020, this is for the measles containing vaccine 2 or the second dose of measles containing vaccine. This antigen is given at 12 months old. 2020 is indeed very challenging. You can see that despite our efforts to normalize the provision of this basic immunization services, we still haven't reached that 95% mark. Although this is still a partial report for 2020, because some of the regions, some of the provinces within these regions have not submitted the reports, but still, if you look at this coverage, less than 40%, particularly in the very populous areas and very high-risk areas, Now, we are hoping that our supplemental immunization can address the gap brought about by a very low coverage for the second dose of measles vaccine. Next. So let's now talk about polio. As I have mentioned, there is still an ongoing polio outbreak. We are still strengthening our polio AFP or acute flaccid paralysis surveillance as well as the environmental surveillance. To date, we still have 16 polio cases and polio infection in the Philippines because we are finding still polio isolates in healthy subjects as well. So for polio cases, it's 16, and the dolls in the second half of this picture, these are healthy subjects, but when samples are tested, they are positive for the vaccine-derived poliovirus. Next slide. So aside from monitoring or doing the surveillance, acute flaccid paralysis surveillance, our environmental surveillance, this is led by RITM. They are also doing our regular sampling of the selected sites throughout the country. Next. And looking at the IPV coverage as well as the bivalent OPV coverage, the third dose, it's similar to the measles 2 coverage. We are really indeed challenged because of the COVID-19 pandemic, so 2020 coverage is not the optimum. Next slide. So we did the first phase of the Mropv supplemental immunization activity last year. And last year, despite the COVID-19 pandemic, I would like to say that we were successful in vaccinating more than 90% of the targeted 9 to 59 month-old children for measles and rubella, and more than almost 90% for the bivalent OPV in the select regions in the country. So despite the COVID-19 pandemic, we salute our vaccinators in the field, the local government unit, all of our midwives, nurses, municipal and city health officers for their efforts, dedication in coming up or vaccinating more than 4 million children for measles and more than almost 2 million children for the bivalent OPV. Next. And so now we come to the continuation of our supplemental immunization. As I have mentioned in the past media fora, this is the time where we want to really boost the immunity of our under 5 so as to prevent the impending outbreak for measles. I mentioned in the past that 2021 is very critical because of the accumulation of susceptibles. It is very possible, it is highly possible that we will experience a very big outbreak if we do not do something for to increase the immunity for measles as well as rubella. So phase 2 is coming up. Phase 2 will be in February 1 to 28, 2021. Same eligible same target, eligible children, 9 to 59 month old for measles and 0 to 59 month old for BOPV. And the regions in green here in the map are the phase 2 areas. So for Luzon, we have 3 regions in Luzon. The very big regions in Luzon, NCR, Region 3, and Region 4A, and all of the Visayas or the regions in Visayas. Similar strategy, fixed site or temporary post. And again, for fixed site, these are all these are the health centers, our hospitals, our barangay health stations, or those areas or those institutions or facilities that have been providing immunization services for both routine and even for outreach immunization. But temporary post, this can be a gym or areas where you can you can set up stations for triaging, for vaccination, as well as for observation post-immunization. Next, please. And for target. Still, the target for the MR is 0 to 59, and we are looking at 4.7 children. We are targeting to vaccinate 4.7 million children under 5 years old and 5.1 9 to 59-month-old for measles. NCR will no longer do polio vaccination because they did several rounds of the outbreak response for polio in 2019 as well as in the in 2019 as well as in 2018. So our targets as well as the areas all are in these slides. Next. Of course, this campaign will not be, we are anticipating challenges. So increasing awareness of the community of the upcoming MRC phase 2 in the regions, although this has been communicated early on, and we have teasers for this activity. Again, some of our clients may have not heard about this campaign, so we want to continue with our demand generation for this activity, increasing awareness in the community, providing them with the correct information. There might be fear in getting the measles vaccine, and there might be some fear as well as feeling of, they are not sure whether this can help them or not. But I think correct information telling them that they should fear measles more than the vaccine, this can be a good entry point for our clients, our mothers, our parents, and caregivers, so that they can understand and they will allow their children to be vaccinated. Of course, there is this vaccine hesitancy for some, for the parents as well, and engaging LCEs to accept or to join our phase 2, because as you know, the COVID-19 rollout gonna be conducted together with this phase 2 in some of the areas. It's gonna be one activity after the other. Ensuring adequacy or adequate number of vaccination teams is also a challenge, and this has been addressed in the past, and our regions are doing their micro-planning together with the local government units to identify vaccinators and to identify the most appropriate strategy to implement the phase 2 MROPVC. Another challenge is the limitation in the operationalization of the campaign due to the simultaneous COVID-19 response. As I have mentioned, we will be embarking on the COVID-19 vaccination in some of these areas which are considered high risk for COVID as well as high risk for other vaccine preventable diseases. So we have to strike that balance. COVID-19 vaccination will involve the older population. We are vaccinating the younger population, so our Health Promotions Bureau has been addressing this adequately, and we hope that before the implementation of the phase 2, the all of this infrastructure will be ready so that with the just like in the phase 1 implementation, we will be successful as well in the conduct of the phase 2 clinical trial. Phase 2 MROPVC. So I guess this is my last slide, and this one is a borrowed slide from Dr. Xiaojun Wang, A Bayanihan Spirit. Every campaign, it's a hard battle, much harder amidst the pandemic. Getting through together once we join our wisdom and efforts, more solutions than problems. Thank you very much for listening. Over to you, Monique.
Thank you, Doc Wilda, for giving the latest updates on the National Immunization Program. Before we proceed with the questions po, Doc Wilda, I think we have one question po from Red Mendoza. I believe this was already discussed in your presentation, ma'am, but just to reiterate from Red Mendoza of the Manila Times, Doc Wilda, what are the problems that you have seen in the last year's immunization program, and what are the steps that can be taken to have more children immunized with MROPV this year? Doc Wilda.
Thank you, Red. We still have this problem of vaccine hesitancy. We saw this in some areas in Mindanao, and I am very pleased to report to you that our Health Promotions Bureau is on top of coming up with, is on top of the situation. They have come up with a good risk communication, addressing vaccine hesitancy. Each of these concerns have been properly presented in each of the national emergency operations center meetings that we are doing here in the central office, as well as and replicated in our regional office. And because of this, correct information have been given. That is one, vaccine hesitancy. As I have mentioned, we have been, this has been a very big problem in the past, but baby steps, we are now reversing the situation. Another is, as I have mentioned, the adequacy of the vaccination teams. Since the COVID-19 pandemic, our healthcare workers, our vaccinators have been multitasking. They are pulled out to assist in the COVID-19 operations, as well as doing the routine immunization and outreach immunization on a regular basis. Plus this supplemental immunization activity, which is not an easy thing to do because there is a timeline for the SIA. So some regions, or most of the regions, have hired additional manpower. They trained them prior to the start of the campaign, and this addressed the HR gap temporarily. And for the phase 2, it was reported in the EOC meetings that most of these regions hired already and trained the NDPs or the nurses hired under the nurse deployment program, those who have not been accommodated in the past because they are already aware of or they have this experience on doing immunization, providing vaccines, then they were the priorities hired by our regions, as well as some of our professionals who volunteered to assist us in the SIA. And this has been now the strategy of most of the regions to address the HR gap. I think those are aside from the COVID-19 pandemic, the the problem posed by or brought about by the COVID-19 pandemic, wherein some areas are under lockdown, and when some areas suddenly declare that they are under lockdown, then our vaccinators cannot do vaccination in that particular area. But good coordination with the local chief executive and updating the microplan and the itinerary of our vaccination teams, this helped us in reaching the targets, even though there are lockdowns in those areas. Anyway, the lockdowns have specific dates, and because of this COVID-19 situation in some of the areas, then here in the central office, upon analysis of the situation, we were able to recommend, extension of the vaccination activity in those select areas so as to vaccinate those children belonging in the lockdown areas. So I guess those were the main challenges we faced, and also I think we will be encountering similar problems for the phase 2, but I am very optimistic that we are now more prepared in addressing this situation, and we have best practices in the areas that can be in some of the areas that we that did the phase 1, and it can be applied in some of the regions that will be encountering similar problem for the phase 2.
All
Over
right.
to you.
Thank you, Doc Wilda, for answering that question. We hope, Red, that the answer of Doc Wilda is sufficient in accordance with the question. Doc Eva, and to you, Sir Crisette, we have a few questions po regarding cold storage facilities. Let me just read the question po. Also for Fred Mendoza, Doc Eva, bakit po kailangan i-cold store ang mga bakuna? Ang mga virus po ba nagiging inactive sa mga cold temperatures while the virus naman thrives on the body temperature of its host? Doc Eva?
Salamat po sa tanong niyo, Sir Red. First, siguro po ang importante for us to understand is that vaccines are not meant to infect a person but to trigger an immune response. No? Tulad po na nabanggit ko sa simula po ng aking presentation, ang bakuna po ay isa pong biologic product. Therefore, if it is exposed in extreme heat or extreme cold, some of its active ingredients may get degraded and will render it less potent or less effective. No? And so, the manufacturers, upang maging mas thermostable ang vaccines, sila po ay kailangan magdagdag ng mga ingredients sa formulation. At ito po ay syempre mga trade secrets. It undergoes a process na kailangan pagdaanan kasi kailangan manatiling safe ang bakuna kahit nagdagdag ka ng mga ingredients na yon. So perhaps po in the future for some of the at least for the COVID-19 vaccines, they may still come up with formulations na pwedeng ma-store siya at milder temperatures. But for now, some of the vaccines will need ultra low or ultra cold freezers. Yun po yung mas challenging. I hope I have answered your question po.
Thank you, Doc. Next question po from Sheila Chrysostom of the Philippine Star. Do you think we are prepared to roll out COVID-19 vaccination in terms of cold chain capacity?
Thank you for that question. First, we need to understand that building a cold chain, vaccine cold chain in the country is not a new infrastructure. I think Dr. Wilda already mentioned our ongoing programs on national immunization na kailangan pang pag-igtigin. So which means we already have a cold chain infrastructure in the country. And the government is strengthening the infrastructure for the vaccines that would require ultra-low chain, particularly for this COVID-19 vaccine. So I think those are important for us to know. And also, I know that the government also has already did the first step, and that is an informed needs assessment, which means tiningnan na nila kung ano yung mga pangangailangan for the COVID-19 vaccines po.
Thank you, ma'am. Next question po from Caroline Bongkin of CNN Philippines. How will the weather in the Philippines factor in the vaccine distribution, like extreme heat or typhoons? Doc Eva?
Thank you for your question. If the vaccine cold chain is maintained, which is really the goal, then the weather should not be an issue. Whether mataas po humidity sa Pilipinas, mainit kapag sobrang init pag summer, maraming bagyo pagka actually buong taon po, no? Hindi po dapat naaapektuhan ang vaccine cold chain ng ating mga weather conditions. And I can assure you that the government has already made preparations also in cases of typhoon po. And uulitin ko lang po, the vaccine cold chain is not a new concept for the government because they have been implementing the cold chain, the vaccine cold chain together with the national immunization program. Baka po may nais idagdag si Yusek Vergere.
Yes, Dr. Eva, just to provide additional inputs, as what Dr. Eva's mentioned, dekada na po ang pagpapatupad natin ng program natin for immunization. So with this kind of weather disturbances dito sa country, laging handa na po ang ating mga facilities. No? In fact, we have generators. Doon po, lalong-lalo na doon sa mga lugar that frequently will have power interruptions because of these weather disturbances. So nakahanda po yan at ito po ay gagamitin pa rin natin ulit dito po sa ating vaccination program for COVID-19.
Thank you, doctors. Next question po, there are a number of media partners who ask about the challenges and bottlenecks that we are facing. Let me just read the question po. What are the challenges and bottlenecks that you're seeing that are specific to Philippines vaccine rollout? And how do you assess government's performance in addressing these bottlenecks? Doc Eva and Yusek Reset.
Again, salamat po sa inyong katanungan. Akin pong in-enumerate kanina yung mga challenges o hamon ng vaccine cold chain. No? Pero ang mga hamon naman pong ito ay alam na rin po ng ating Department of Health. Kaya gumagawa po sila ng mga paraan to address such challenges like yun pong when I talked about the challenges earlier, this is like pangkalahatan. Globally, we need to address problems of power interruptions. Katulad naman po na sinabi ni Yusek Vergere, meron na po tayong mga generators in place for that. Tapos po, yun pong yung stability na electrical supply can be addressed by putting mga UPS, yung mga uninterrupted power supplies po. And then of course, in terms of processes and supplies na mention ko kanina, yung we cannot displace the doses of vaccines for our national immunization program. Katulad po nung sinabi ni Dr. Wilda kanina, yung measles and polio vaccination program, yung mga doses nun, syempre kailangan din po nun ng refrigerator space. So ang gobyerno po, ang DOH specifically, gumagawa rin po ng mga hakbang upang hindi po madi-displace yung storage space ng mga vaccines na yon. At ang alam ko rin po, sinimulan din na po ang proseso ng pag-provide ng mga ultra-low freezers for those vaccines that will need minus 70 degrees centigrade storage. Thank you po.
Thank you, Doc Eva. Next question po from Aiko Miguel of UNTV. How are we going to distribute COVID-19 vaccines in cold storage facilities in different areas? Do we have a unified plan? When and how long will the vaccines be stored to avoid wastage?
Siguro po i-request ko po si Yusek Derhering sagutin po yung kasi it's the government plan for this po. Yusek?
Yes, thank you, Dr. Eva. Nick, can you please repeat lang yung question?
How are we going to distribute COVID-19 vaccines in cold storage facilities in different areas? And if we have a unified plan of when and how long will the vaccines be stored to avoid wastage? Yusek.
Well, as what Dr. Evas mentioned a while ago, no, there are specific technicalities or details that has to be complied with for each type of vaccine. So sabi niya kanina, yung negative 20, kailangan nakastore pa rin in the usual 2 to 8, pero it has to be consumed no, within 30 days. Ang bakuna rin na isustore ng mga negative 70 to negative 80, meron din mga ganyang indikasyon. So how are we going to distribute? Because of the challenge, because we have different types of vaccines with different logistical requirements, naglagay na ng strategy ang ating gobyerno kung saan yung mga negative 70 to negative 80 na required storage ng isang bakuna, like yung mRNA na bakuna na yan, ay ilalagak lang natin o ibibigay natin dito lang sa mga areas which have the capacity to have this kind of facilities. And this would be the urban areas like the National Capital Region, Region 7 in Cebu. We have the Davao region also. Also binanggit din some areas of Region 3 and Region 4A. Now, when it comes to the other vaccines naman, dun mailalagay naman natin sila no, all, across the different regions. So the distribution plan would be that if these are regular storage requirements like the 2 to 8, in-indicate na po yan, dadaan po yan dun sa central storage hub natin, which is the RITM, and then it's going to be distributed to our regional offices where these are our sub-national hubs, and then it's going to be provided to all of the local governments. Now, when it comes to this highly technical or yung storage ay ultra-low, as I've said, dito lang po yan ilalagak sa mga urban areas, and also we have this arrangement already with this private partner kung saan mag-end-to-end na tayo. So the potency and the viability of these vaccines will be maintained by having these private partners managing this end-to-end process for this type of vaccines.
Thank you, Yusek. In addition to that po, Lanes Kapandi has a clarification. Given po the Pfizer vaccine needs shorter amount of time to be administered upon thawing, ruled out na po ba ang deployment ng Pfizer vaccine outside Metro Manila, Cebu City, and Davao City?
Ako pa rin yan, Doktora, no? Okay, kung yung requirement nga, no, ay, everything is evolving. Ngayon po, initially, we have these facilities na sabi natin, kaya natin dito sa Metro Manila, sa Cebu, sa Davao, Region 3, Region 4A. Pero as time will go by, maraming partners na nag-o-offer sa atin ng mga ganitong facilities and equipment. So we will see. Malay mo, sa susunod po, in 2 months' time, we will be able to set it up also in other areas of the country, and then we can also roll out this kind of vaccines to them. Hindi po natin kino-confine niya na ngayon, final na tayo lahat. Everything will evolve because of the developments that will happen.
Thank you, Yusek. Last question po, from Rafael Bosano of ABS-CBN. While the government is working on making sure that there is proper storage for vaccines, na-anticipate na po ba ng DOH kung ilang % ng mga bakuna ang maaaring hindi magamit due to various factors?
Can we ask Dr. Wilda na? This is the wastage for the vaccine program. Dr. Wilda?
Yes, for the wastage, depende po kasi sa preparation ng vaccine. We computed the wastage for the medyo mataas for the COVID-19. I think the computation was 25%, 1.021. But let me check that because individual vaccines kasi individual preparation has different wastage factor. And I will just email Monique the different wastage factors for each of the individual vaccines because they have different wastage factors.
Thank you, Doc Wilda. Doc Wilda, also in addition to that, Sophia Tomacruz of Rappler is asking if LGUs will need additional cold storage capacity on top of those already available for the National Immunization Program.
All right. In 2018, we did our effective vaccine management assessment. And cold storage capacity of all of the administrative levels, from national to regional to provincial to local, we assessed this. Some we assessed the capacity. It's not similar across the country. Some regions have excess capacity, some have just enough. I am talking about routine vaccines, and some still need additional capacity. For local government units, again, the answer is depende sa local government units because some will be needing additional capacity on top of the routine as well as on top of the catch-up. So, kung tatanungin ang NCR, the result from the 2018 assessment, they will be needing more capacity because the capacity is just enough for the routine as well as kasi kailangan din yung other vaccines like our anti-rabies vaccine that is also part of the equation. So for NCR, we will be needing more storage capacity for NCR if we are the COVID-19 vaccine, if we are talking about the COVID-19 vaccine.
Thank you, Doc Wilda. I believe those are all the questions for our guests. Doc Eva and Doc Wilda, would you like to say a few words po before we proceed with the DOH questions? Doc Eva, you go first po.
Uulitin ko lang po ang aking naging mga mensahe. The vaccine cold chain keeps vaccines at the right temperature during each link on the long journey ng one day or the vaccines were manufactured up to the time that it will be given to the target population. There are different requirements of vaccines which call for different distribution plans. Challenges in the cold chain, meron po tayo and the government, the Department of Health will try their best to address those challenges. Tulong-tulong po lahat ng ahensya ng gobyerno para dyan. Kasama rin po ang private sectors na sabi nga po ni Yusek Vergere na nag-o-offer din pong tumulong para po dito sa ating mga additional challenges for the COVID-19 vaccination. But the last is that the vaccine cold chain, whether it is our routine vaccines from the National Immunization Program and also the upcoming COVID-19 vaccines, the vaccine cold chain needs timely, reliable, and efficient collaboration of many players. Maraming salamat po.
Thank you, Doc Eva. Doc Wilda? Doc Wilda, if you're still in the call po.
Hello, can you hear me?
Yes, Doc Wilda, go ahead po.
Okay. Maraming salamat. As I have mentioned, tatlo na po ang nasa top priority natin na vaccine preventable diseases. One is measles, another one is polio, at pangatlo na po itong COVID-19. So with the advent of the vaccine, yung COVID-19 po natin ay isa na ring vaccine preventable disease. equally important that we do our part to stop the transmission of all these top three vaccine preventable diseases. We should do our part, every one of us, kasi lahat po tayo stakeholders. Kailangan po nating mapanatili na malusog ang ating sambayanan and free from vaccine preventable diseases, such as the ones I have mentioned. And how to do this? Pagbabakuna lang po. But aside from pagbabakuna or magbabakuna yung ating mga na-mention na target, napaka-importante pa rin po na panatilihin ang ating the COVID-19 protocol for infection prevention and control has to be followed to the letter. As I have mentioned in my previous talk, what saved us all prior to the advent of the COVID-19 is number 1, frequent hand washing. Number 2, the safe distance. And number 3, our cough, our cold etiquette. Wearing face mask and face shield. Those interventions saved us prior to the COVID-19, prior to the advent of the vaccine. And also, hindi lang po importante yon para sa COVID-19 transmission, but for other infectious diseases as well, just like measles, which is also a respiratory virus. Kaya po, magpabakuna and yung ating protocol, the BIDA solution has to be followed as well. So sa inyong sa ating lahat, maraming salamat for the support of the media. I am very confident na maipaparating ang tamang impormasyon. Sa ganon ay the acceptance of vaccination will increase at mababawasan yung vaccine hesitancy. So, thank you very much. Magandang umaga po sa inyong lahat.
Maraming salamat po to Dr. Eva and to Dr. Welda. We'll now be proceeding to the questions for the Department of Health. Yusek Reset.
Yes, I'd just like to thank Dr. Eva Maria Cotionco de la Paz and Dr. Maria Wilda Taguda Silva for accommodating our invite for today and giving us very informative details about the cold chain and about the MRC that we are going to conduct for the department. Maraming salamat po sa inyo. Thank you.
Maraming salamat po. We'll now
Maraming salamat din po.
Thank you.
Thank you po. We'll start now, Yusek. From a question po from Greg Gregorio of TV5 as well as from Sheila, they're asking for updates po on the contact tracing efforts related to the 16 newly detected UK variant cases as well as to the conditions of the close contacts of our UK variant case from Dubai. It also further details po, as what you have said, ma'am, from the Laging Handa last Saturday, na may isang Pinoy from abroad na dumating sa Bontoc on December 13th and nagkaroon ng ritual causing mass gathering. And on December 14th, nagsimula ng manifestation na symptoms ng mga tao. Kamusta po ngayon yung umuwi noong December 13th, ma'am?
Okay, thank you. Greg, linawin natin, yun pong kababayan natin na umuwi galing sa United Kingdom, umuwi siya dito ng December 13. Siya po ay nag-quarantine, tinest, nag-negative nung 14. Nakauwi po siya dun sa Bontoc province ng December 14. And pagkatapos noon, he stayed there with his relatives. They are in a household, kasama niya yung asawa niya. And on December 25, nagkaroon sila ng pagdiriwang because it's Christmas. December 26, they had a ritual because they have these beliefs dun sa kanilang lugar. And then December 29, nag-umpisa na siya magkaroon ng kanyang simptomas. Okay? So just to clear that timeline. Yung tanong, kamusta yung contact tracing? Yung contact tracing para dito sa mga taga Bontoc, no? In Bontoc, we were able to identify 12 na mga residente ng Bontoc na nagkaroon itong UK variant. Ang atin latest sa ngayon, the one that we got this morning, meron tayong na-identify na 144 close contacts coming from these 12 Bontoc UK variant cases. So 144 sa kanila. At dito sa 144 na ito, ang positive, no, dun sa mga among these close contacts. Because let me just remind everybody, no, that this is not the first time that we're doing the contact tracing, because these people who got positive already, no, nung mga ibang panahon, bago natin nasabing may variant sila, na contact trace na sila before. So, tinignan lang natin lahat ng detalye, and then we are now expanding the coverage of the contact tracing. So, dito sa contact tracing na ito, meron tayong nakita na additional, no, na 34 na positive pa, but they were not positive for the UK variant. So, meron tayo ditong mga 144, 116 ang na-test, and 34 without the variant, no? And yung sinabi nga natin, 12 yung may variant. What we have seen here in this contact tracing efforts was we were able to identify already 3 clusters of infections. Ibig sabihin, mula dun sa kaso na pinagsisimula nating tignan, wala pang, let me just give this clarification, wala pang definite. We're just giving you the details, pinag-aaralan pa further itong lahat na nakukuha naming detalye ngayon. So itong 3 clusters ng infection na nakita natin, nakikita na natin yung pagkakahawa-hawa na nangyari dito sa mga areas na ito. Nakita natin yung mga pinagmulan, pero sabi ko nga hindi pa siya definite because we still need to backtrack at titignan natin baka may iba pa ring lumabas ng bansa at bumalik dito sa lugar na ito. Pero as of now, we have identified 144 close contacts, first and second, no? Kasi yung iba, contact na sila nung first generation contact, kaya second generation contact na siya. 144 sa ngayon at nag-expand pa rin tayo ng coverage natin. For the person na galing sa Trinidad, Benguet, ito yung isa pang may positive sa UK variant, naka-identify na tayo ng 97 na close contacts niya, first and second generation na close contact, no? And dito po naka-identify tayo na meron na pong nagpositibo na kasama niya sa loob ng kanyang bahay, no? Household, nanay, tatay, kapatid, no? At saka ang lola. 4 po ang nagpositibo dun sa close contacts niya. And the rest, wala pa, may negatibo po sila. Lahat po are isolated or quarantined. At atin pong fina-follow up pa rin, tinitignan natin kung meron pang makikita natin na madadagdag dito po sa mga close contacts na na-identify na at nakuwanan na po ng mga detalye, and we're advised already. As to these 2 ROFs from Lebanon, yung taga Iloilo and taga Binangonan, na-locate na po natin yung taga Iloilo. Yung sa Binangonan po still bine-verify pa rin ng regional office namin. And yung sa Calamba, Laguna, they are now currently doing the initial investigation. So yan yung update natin sa lahat ng contact tracing na ginagawa natin sa ngayon.
Thank you, ma'am. From Sheila Chrysostom of the Philippine Star, Macau is now implementing 21-day quarantine for international travelers due to the threats of the new COVID-19 variant. Is there a need to extend the quarantine period being implemented in the country?
I don't think so. Ganun pa rin naman po. Katulad ng sabi natin, itong variant naman na ito, hindi naman po nabago yung ating mga detalye or mga mechanisms of the virus to infect. Sabi niya, di ba, sabi ng experts and evidence states, ang mode of transmission is still the same. Incubation period is still the same. So I don't see the reason kung bakit kailangan natin i-extend pa. Ang kailangan natin gawin ngayon is strengthen natin yung current protocols natin. Kailangan yung quarantine and isolation protocols ng LGUs should be further strengthened. They have to ensure na lahat po ng i-endorse sa kanila ng national government for quarantine or isolation should strictly comply with the 14 days para po hindi tayo nagkakaroon ng ganitong detection at kumakalat po ng ganyan. Kung atin lang po mapapaigting ang ating mga protocols, we will be able to manage and prevent this kind of occurrences. So I don't think na kailangan po at this point to extend to 21 days ang ating quarantine or isolation.
Thank you, ma'am. Next question po, can we give an update po on Janssen, Clover, and Sinovac clinical trials? Kailan sila magsisimula and ilang participants ang kailangan?
Yes, actually, nung isang araw, we were given these updates coming from the Department of Science and Technology. Nakikipag-usap sila ngayon dito sa contract research organizations. If you will remember, the CROs of these specific manufacturers na napayagan na mag-clinical trial dito, sila yung may responsibilidad para mag-recruit, para mag-manage itong clinical trial na to together with the proponent that they have identified. Ngayon, ang sabi nila, hindi pa rin ho nakakapagbigay ng mga detalye for the assigned sites itong tatlo na mga CROs dahil pinag-uusapan at pinag-aaralan. Nakapagbigay ang Sinovac but later on, kailangan nilang ibalik at pag-usapan uli kasi yung mga sites na iba na binigay ng Sinovac ay kapareho nung site ng WHO Solidarity Trial. Matatandaan natin na ang IATF inendorso po ang WHO Solidarity Trial for Vaccines na ito po yung susuportahan ng ating gobyerno. Kaya kung ano man hong sites ang mapipili o mai-assign for this WHO should take precedence over the other trials. So they cannot be duplicated. So kailangan lang po na makapagbigay tayo ng advice sa mga CROs on what specific sites WHO will be assigning their trial participants to para hindi po naduduplicate ng mga independent trials na ito.
Thank you, Yusek. Next question po from Christian Manyo of DCRH News. With the detection of B117 variant, which is more transmissible, would you recommend to implement again the stricter protocols in public transport? Ngayon po kasi dikit-dikit na sa mga PUVs.
Kailangan lang siguro, Christian, ipatupad ng maayos. No? Hindi naman kailangan na agad-agad tayong nagkakaroon nito mga stricter protocols uli. Kailangan natin balikan yung objective kung bakit naman binubuksan ng mga ibang sektor ng ating society. It's because of balance ng health and economy, no? And kung tayo lang ay susunod doon sa mga pamantayan dahil ito naman ay nabigyan na rin ng pag-aaral at pag-aproba ng ating IATF officials, and then we can prevent further infection. So I think enforcement and strict compliance to these different protocols would be the key. Di natin kailangang isarado uli lahat ng mga iba't ibang sektor ng ating lipunan kung atin lang pong masusunod yung mga protocols na meron na tayo sa ngayon. Pero of course, titignan pa rin natin. It would all depend on the number of cases that we will be registering for these coming days and weeks. No? I-observe natin yan, and we have these measures and parameters to determine if we need itong mas stricter na classification ng bawat area o yung ibang sektor ba ay kailangang ipagpaliban muna ang pagpapatupad ng pagre-relax nito mga measures na ito.
Thank you, ma'am. From Caroline Bongkin of CNN Philippines, may update na po ba sa genome sequencing ng ibang returning OFWs, including dalawa in Cebu, who recently went to Dubai, and in local cases from other areas with significant increase in cases? Ma'am?
Wala pa, Caroline, no? So, di ba sabi natin, every week yung ginagawang sequencing. So, during this time, collection tayo ng specimen, and usually over the weekend until Monday, inaayos yung mga pinadalang specimen sa Philippine Genome Center, and then they run it. So, yung run time natin will usually take 2 to 3 days. So, we'll expect by the end of the week siguro uli, makakuha tayo ng bagong resulta.
Thank you, ma'am. Next question po from Red Mendoza of the Manila Times. Are media personnel part of the priority list for vaccines? How would the media personnel be vaccinated? Dapat ba sagot ang media company? Or pwede rin ba silang maging part ng LGU vaccination?
Red, kailangan natin maintindihan and for the information of our public. Yun pong ginawang strategiya at saka plano ng national government. Lahat po tayo kasama doon, lahat po ng Pilipino. Magkakaroon lang tayo ng prioritization. Mauuna yung healthcare workers, mga matatanda, but the rest of the population, all Filipinos except children, will be provided for free ng bakuna na ito ng national government. So kung sakali po ang mga media practitioners, you are part of the frontliners din naman, but you are part of the group B in the prioritization. So you will receive your vaccines and you will be master listed by your local government. Ngayon, pag dumating po kayo dun sa punto na inalok kayo ng local government nyo, wala naman din yung problema yon. Kaya lang, kailangan sabihin dun sa master list that LGU has provided you already. So, ganun lang. Pero lahat po tayo assured that we will get our doses. Yun lang nga po, may prioritization sa ngayon.
Thank you, ma'am. Next question po, aside from Red Cross, may mga iba pa po bang company na nagbabalak ng saliva testing for COVID-19? Paano ang magiging rates nito and isasama po ba ito sa department order sa price range ng testing?
Sa ngayon, Red, yung ginawa natin, we approved the Philippine Red Cross utilization or use of this saliva as alternative specimen. No? And we said in the approval, nakalagay doon, na among Philippine Red Cross laboratories lang muna gagawin ito. So for the other laboratories, aantayin muna natin yung test or validation study na ginawa ng RITM before we can fully implement saliva as alternative specimen. Now, when it comes dun sa mga price range, hindi pa natin siya maisasama kasi not all laboratories are implementing this. When we do the full implementation and then we can be able to determine kung kailangan nating isama or mabago siguro, no, hindi talaga isama, hindi siya separate, no, isang proseso siya with RT-PCR. So ang gagawin natin, magre-recompute tayo. Titignan natin for those using saliva, magkano na lang yung price range na dapat as compared with the regular RT-PCR which uses the NPS or the nasopharyngeal swab.
Thank you, Sec. Ma'am, I know you have a briefing right after this, so perhaps we'll do the last question, and then for the other questions po, we'll send via Viber. The last question po for today from Greg Gregory of TV5. In a radio interview this morning, contact tracing czar and Baguio City Mayor Benji Magalang said, may mga LGUs daw po na nagtatago ng kani-kanilang COVID-19 cases. Some are also lowering their contact tracing and testing efforts to lower their recorded cases. May we get the reaction of the DOH on this?
Well, if that is at all true, no, binibigyan lang ho namin ng abiso at siguro warning yung ating mga local governments. And I guess yung nangyari po dito sa Bontoc province is a very good example, no, kung paano po ganun kabilis kumalat ang sakit na ito. So sana po ang ating mga local government units ay maging katulong po natin dito po sa pagpapaigting ng ating mga protocols. Kung sakasakali po na medyo mataas ang kaso natin, makakahingi naman kayo ng tulong sa national government so that we can provide assistance at ma-address po natin ang pag-prevent at pagbaba ng kaso sa inyong lugar. Ngunit kailangan lang po na maging maitala po natin ang tamang mga numero para nakikita po natin kung ano ang dapat gawin ng ating gobyerno. Dahil kung hindi po namin matatanggap din ang mga tamang numero, hindi rin po natin mahahanap lahat ng kailangang hanapin ng mga taong naging contact ng mga positibong kaso at maaring dumami pa ng dumami ang ating kaso. Pangalawa, kung hindi kompleto ang datos ng national government and even the local government, hindi po natin ma-analyze ng maayos ang mga numero natin and we cannot provide rational and effective strategies for us to be able to halt the transmission of this disease. So nakikiusap po kami sa local governments, magtulong-tulong po tayo. Nandito po ang national government para tulungan kayo and to provide assistance kung sakasakali nagkakaroon po kayo ng mga issues at mga challenges dyan sa area nyo because of the number of cases.
You said those are all the questions we can accommodate for today. Ma'am, your final message before we end today's forum.
Yes, thank you. We will just need to end this because I have a briefing at 12 with spokesperson Harry Roque rin naman, and you ask your questions there also. So we just like to thank our National Immunization Program Manager, Dr. Maria Wilda Silva, also our the UPNIH Executive Director, Dr. Maria Eva Maria Cotyongco. Ang dami ko sinabi, Maria de la Paz. Dr. Eva, maraming salamat. Dr. Wilda, thank you very much po sa pagsama sa inyong dito sa aming media forum. So lagi po nating alalahanin ang halaga ng responsableng pagbabahagi ng information. At sa tungkuling ito ay nararapat lang na iisa ang ating kilos para sa kapakanan ng ating mga sarili, ng ating pamilya at ng ating komunidad. Atin pong isaisip na ang ating paggamit ng social media ay may kalakip na responsibilidad na magbahagi ng tamang information. Ika nga nila, you think before you click. Pagkat sa bawat tamang impormasyon na ating binabahagi, ay nailalayo po natin ang ating mga mahal sa buhay mula sa peligro ng COVID-19. So maraming salamat po sa inyong lahat. We will see all of you on Wednesday. Thank you, Nick. Thank you, Dr. Eva. Thank you, Wilda.
Salamat po.